Looking back at the founding of the World Bladder Cancer Patient Coalition, what were some of your personal hopes for the future of the organization? And how has its growth and impact aligned with your hopes and expectations back then in 2019?
Yeah, so I think conversations began around 2017 when we knew each other a little bit. We bumped into each other, and we had friendships with France and Australia and Canada, but there was nothing formal. So it was all just friendships at that stage. And I spoke with so many of you in the audience, and Andrew Winterbottom as well, and said, wouldn't it be wonderful if we actually had a global voice for people with bladder cancer? And we also knew that at that stage, it was only the high-income countries really that had bladder cancer organizations. So it was a lot of work, but it was really rewarding to go through the process of actually setting up the World Bladder Cancer Patient Coalition and setting it up as a legal entity. We set it up in Belgium. And so we actually needed to wait for an official declaration from the King of Belgium as well. So we've got that on file as well. And so yeah, we had six board members to begin with, the founding board members, two from the UK, two from America, and two from Canada. And I'm so grateful to my five other board members who helped us with this. And yeah, we didn't even have a chief executive at the time. We had just a virtual office. Yeah, three members. And yeah, we began in 2019. And what I really wanted it to be is to be a true World Bladder Cancer Patient Coalition, and to truly represent the world. But back in 2019, we had a long way to go. And so one of the first and best decisions that we made was hiring Alex Filicevas as the very first executive director of the World Bladder Cancer Patient Coalition. And today is exactly his 5-year anniversary as well. So 5 years.
It feels kind of special. Thank you. It feels special to be having that conversation about the last 5 years, because it is indeed the very first time that I started was October 1st. And to be able to do it in this room with all these many advocates, some new faces over the last 5 years that we developed, so it's a really special moment that we can celebrate at the end of the day.
And yeah, so I can remember meeting Ken Bagshaw from Canada and myself. We traveled to Brussels in February 2020 to meet with you as well. And that was just, we were so excited about starting this new chapter and hiring you. So what has been the most rewarding aspect of leading the World Bladder Cancer Patient Coalition? And maybe you can share a personal experience.
You know, 5 years ago, we had a small group, right, of the board of 6 board members and the 3 founding members who started the organization back then. It was so special to see that small community essentially donating their time, right, donating their time for several years leading up to that, to start a patient organization, a global organization that can bring together all our bladder cancer patient groups around the world, help start the new groups as well. We've heard some today as well from Laurent. And so to seeing it now, how much we've grown, and seeing patient advocates with patients themselves who donate their time, often from their own experience and not necessarily a very positive experience, lack of information, things like that, and really going there to make a difference for those who come after them. And I think that's what inspires me a lot every day, is how much within our community is the passion to help others, drawing from own experiences that may be not the most positive themselves. And so it was a very special moment to also being entrusted with building an organization from scratch, essentially, right? We had our King's signature, as you said, which feels kind of special still, right? And then setting everything up, setting up the organization, its functionality, building our community, etc. So even all the boring administrative things that both Stephanie and Laurent mentioned today as well, it requires a lot of patience. But it's great because we do it together, we learn and we help others in the process. And I knew Andrew Winterbottom as well, who was, the founder of Fight Bladder Cancer in the UK. He was one of the founding people who were involved in the establishment of the World Bladder Cancer Patient Coalition. And so carrying that vision, having that responsibility to help carry that vision that Andrew had, to have that global voice, to have also make sure that we work towards having a bladder cancer patient support organization in every country, so to make sure that no matter where people live in the world, they have a place to turn to for support and information. So carrying Andrew's legacy, it's a big important part. But for me, what left a lasting impression was our first World Bladder Cancer Patient Forum. So today we are here in our third one in person, and seeing it grow from that moment. But the very first one we had in Paris in 2022, right? It was the first meeting after the pandemic as well. And for me, that was really special because it was an opportunity for the first time for me to meet pretty much everybody that I worked with over the screen for the previous 3 years, especially during the pandemic. Lydia, I knew some of our board members back then, but we had a majority of people that I worked with online. I've never met them in person. And so it was a truly inspiring moment to be able to connect with them, really build those relationships, and even more important, to provide a platform and facilitate a place for these connections to be built within our member organizations and build these connections. And I see that this fireplace is definitely needs some love and nurture. There you go, it's working. So bringing all these people together, not just personally meeting them, but actually providing a platform to connect. And I hope that's what you are all also doing today. And that was a truly special moment for me.
Thank you.
And Lydia, what have been some of the most significant milestones looking back, or accomplishments in your eyes that over these past 5 years, and particularly in terms of impact that we may have had or potentially leading to having a bladder cancer patient experiencing care?
Well, I would echo your statement about the forum, because I think this is one of my favorite days of the year, because I have built so many relationships and I have learned so much from all of you in the audience. And all of you have donated so much expertise to me as well. So many of the in the UK, so much of the stuff that we do is directly borrowed from all of you. Our work on GP education is inspired by Australia. Our work on translations is inspired by Canada. Our work on reaching underprivileged populations is inspired by South Africa. So I've just learned from all of you. Our health technology assessment campaigning for new drugs is inspired by France. And I not only see that within Fight Bladder Cancer, but I see that within all of our member organizations, that so many of the projects that you're doing in your local countries are inspired by similar projects in other countries. And because of the friendships that you've built here in this room, it's much easier to share that knowledge, because you can just pick up the phone or send an email and you already have that. And then to see new member organizations as well, for example, in Spain, that we never had before. That's going to make such a huge difference to all the bladder cancer patients in Spain. So thank you for all the time and the tears and the effort and the energy and the passion that you have done to establish your Spanish bladder cancer patient organization, because it's going to make a world of difference. I'm also really proud of the Global Bladder Cancer Patient Survey that we did as well. 1,200 sponsors worldwide. It was published in a scientific journal, and it's been published at scientific congresses as well. And now we can do evidence-based advocacy. So it's not only anecdotes, but it's statistics. And so we can stand up there with much larger patient advocacy organizations and say, this is what needs to be done, and this is the evidence behind it. And I also really love our Bladder Cancer Awareness Month as well. I love the pins that we have, the unsure icon here. I love the fact that now we have a global symbol for the uncertainty that surrounds a drop of blood in the pee, and the importance with a stopwatch that you must get it seen. And so I love the fact that we have now a symbol for World Bladder Cancer Awareness Month. And I love seeing every year it growing and growing. going, and I'm looking forward to hearing about some of the grants that we gave as well to low and middle income countries, so that we could do real grassroots community-based awareness as well. So there's so much to be proud of. So a question from me to you is, what relationships or interactions with our member organizations have had a personal impact on you? And how have those connections shaped your own vision for the future of the World Bladder Cancer Patient Coalition?
I think there's been a lot of evolving sort of to the relationships that I have and we have as an organization with our members. We started with 3. Now we have 15 member organizations in 12 countries, 12 very diverse countries as well. And so these relationships have also been evolving in terms of how interact with them. And there's so much more also purpose-driven and purpose-focused on helping each other, connecting people, connecting projects, and things like that. And I think as we grow, we bring so many different organizations from different countries into the fold, and each of them bring their very unique perspectives and experiences as well. Apologize, into the fold. And with that, I think obviously there is some challenge to finding common threads within our communities, right? Because we have, as Lydia mentioned earlier today, have more members in high-income countries. The challenges in low-income countries might be slightly different. Where prevalence varies, incidence varies from region to region. With priorities might be different from one group to another. So really working on finding those common threads is something that we're investing time in, and I do as well. And you've mentioned at the beginning as well the global voice, right? We've set up World Bladder Cancer Patient Coalition to be the global voice for people affected by bladder cancer. And so with that, I think comes responsibility too to be truly representative. So bringing in this different perspective and be very much inclusive and mindful of how we provide a platform to bring in these perspectives into the conversation, into the work they do, into the projects, and how we can help our member organizations in every country. So not just selective, but really helping them and helping each other in the process. And seeing Bladder Cancer Awareness Month evolve, I think that's been truly great. We started off, in 2019. Well, 2020 was the first one that I've worked on fully. It's the pandemic time. It was a very different time how we approached awareness during that period. It was very online focused. And since then, we've evolved so much, I think, in terms of developing a common symbol that you have just presented, the Ensure icon, involving members much more in the creation and brainstorming into what is needed, how we can find the common themes, common conversations, and inspire each other at the same time. And then we've launched the BCAM grants that you've mentioned. So now for the 3rd year, we had Bladder Cancer Awareness Month grants that we award to projects in low and middle income countries. And it's been really wonderful to see. I think we started with 7 grants applications in 2022 to having had more than 100 this year. So it's growing, there's an interest, and there's some wonderful examples that we'll have on day 2 tomorrow to discuss and share as well. And of course, all of this could not be done without my great team. So Theo and Marie, who are at the back and and hiding, but they're doing all the work, all the difficult work. And I'm truly grateful. I think they're helping us drive us forward, and I could not do that without them. And so just in closing on that question, I think as we grow, for me, the most important thing, as we expand, we get bigger, to maintain those personal relationships still with each and every one of you. And that we are able to have that open channel of communication and help each other, but also brainstorm and see how we can collaborate together. And that's why events like this, as it is a favorite event of the year for you, Lydia, it is the same for me, because that's when we really get that face-to-face time. Not enough still, I think, especially when you're organizing an event. I feel like I would want to spend much more time with each of you. But that's how I think we can maintain those relationships with the coalition, with the members, and among yourselves as well. So Lydia, I have another question for you. How do you think the role of World Bladder Cancer Patient Coalition has changed in the global advocacy landscape? Because that's been evolving quite a lot. And how do we position ourselves among other international cancer patient organizations in this field?
I think it's important to remember that the World Bladder Cancer Patient Coalition only has 3 paid staff members. So it's Alex and it's Theodorus and it's Murray, and that's it. So everything that you see coming from the World Bladder Cancer Patient Coalition is coming from the laptop of one of those 3 people as well. So huge congratulations to all 3 of you for all of the amazing work that you do, because I think that in terms of the quality of the work that we do and the representational aspect, I think that we are really at the top of the international bladder cancer patient organizations. And I'll share an anecdote. One of our board members actually represents a pan-cancer organization, and she gets invited to a lot of different boards because she's fantastic, and also because she can represent a low middle income country in cancer. And she said that she wanted to join our board and she wanted to join our organization because she sees that the World Bladder Cancer Patient Coalition is truly global, is truly emphasizing that bladder cancer affects people in high, middle, and low income countries. And I was so honored when she said that, because that is truly a vision of mine, to make sure that although we might not have quantity, everything that we do is quality, and everything truly represents the diversity of the community that we represent.
True. I think maybe we should recognize this board member. So you have a question.
I do have a question for you. How do you envision the World Bladder Cancer Patient Coalition role in the global bladder cancer space evolving in response to emerging challenges and trends in healthcare, especially patient advocacy?
I think the number one thing was what was one of the more important things for me when I started as well was building up our own evidence base to support evidence-based advocacy, because now we have, with the Global Bladder Cancer Patient Survey, which we published last year, and we continue to present this at different congresses and disseminating the results. That was our first community evidence base to support our advocacy efforts, to guide our work, what we want to do, how do we do that, and also provide this data and information for our member organizations to do work on the ground. Stephanie has mentioned this, and tomorrow we have some other examples how this data is supporting that. And bringing that community insight into the global fold to support the advocacy, and at the same time trickling it down to the national level as well. I wanted to also mention that our relationships also externally have been evolving a lot. So we had, working with healthcare professionals, we had great input already today from wonderful healthcare professionals who are great advocates themselves as well, great patient advocates themselves. And there are many more around the world who are not in this room, but they have been fundamental to a lot of the work that we do and contributed to development of the survey, getting also visibility to bladder cancer patient issues and challenges into various policy opportunities and policy discussions, bringing in patients into the discussions of evolving patient care into the future. So that's a really important part. We have evolved also our relationships with industry partners who, do not only just support our projects and initiatives, but they truly also strive to involve more patient voice into all the aspects of the work that they do. And we'll have an opportunity also to hear about that a little bit later today in the discussion. And then there are there's so many things that are changing. And I think in the last 5 years, I've seen so much change in patient advocacy space and where the priorities are for many stakeholders around the world. And I think patient-centered care and shared decision-making, it's a very important part. And I think here as a coalition, we have an opportunity to support our members, but support also new organizations and other stakeholders in making sure that we can help with patient education and empower them with tools and information about participating in their decisions surrounding their care. As well as health literacy elements, and that's where we can collaborate. I think Michelle, you spoke to this earlier. Languages, translations, how we can share these tools that already exist among ourselves. And then lastly, I think also wanted to mention regulatory and policy changes, which is an evolving space. And we have so much more patient focus in some countries or regions more so than the others, but there is so much evolving space there where patient voice is becoming very fundamental element of a lot of policies in health specifically. And so I'm glad we have some sessions about policy, tomorrow workshop on policy for our member organizations, and a session later on today as well on health technology assessment. So these regulatory conversations too. And patient advocacy in clinical trials as well. That's a really important field. And I know that we have been growing this part of our work, both in industry partnerships, research, but also in the medical community as well. So we're trying to build this up a lot, and I think it will require a lot of capacity building as well for member organizations to be able to I would say not to carry that responsibility, but to be able to meaningfully contribute. And we have a bigger pool of people who can feed into this nationally, but also around the world. So we're sort of heading towards the end, and I just wanted to ask Lydia as well, what was particularly a challenging moment from your time at the World Bladder Cancer Patient Coalition that stood out for you, and how did that experience also shape your thoughts on leadership and how we approach our mission altogether as an organization?
So I will quickly share 3 challenging moments. We've had many people join as members of the World Bladder Cancer Patient Coalition, but we've also had organizations leave. And that has been really, really hard for me because I've built personal relationships with those people who felt that they wanted to leave. And I felt like a failure as the president of the World Bladder Cancer Patient Coalition, because it's my job to build consensus, to listen to all the board members, listen to all the members, and make sure that our vision is the same as their vision. So I was quite heartbroken when some members decided to leave, some organizations decided to leave. And I hope that we can still, and we still do have good professional relationships with them, but when I don't see them in this room, that does make me feel like maybe if I had tried harder, if I had listened more, that maybe they would still be in the room. The second is that we have in our Articles of Association of the World Bladder Cancer Patient Coalition that board members can only serve for 6 years, and then they have to step down. And my 6 years are coming up next June, and Alex and I have worked so closely together for so many years, and I've worked so closely with so many of you that it's going to be, I'm so proud of all of you, and I love working with you, and you raise up my energy. And when I see a Zoom meeting with you on my calendar, I get so excited. And then to see you face to face is such a delight and a privilege. So that is just going to be really, really difficult to say goodbye. And then I think finally we can just reflect on the pandemic as well. So we hired Alex, and then we said, let's have our first ever face-to-face meeting, March 2020. So that is the time that we'll have it. And we paid for all the hotels and we booked everyone's flights. Nothing was refundable because we thought it's definitely going ahead. And and then poor Alex started this new role, which is all about relationship building. And he had to sit in his bedroom for 2 years and not actually meet anyone.
Can you imagine that? Yeah. Well, we've all been through we've all been through this, and it seems like a lifetime away, but ago. But it also feels at the same time like it was very recent. It's a bit of a mind-boggling situation. And for me, the pandemic was a challenge because it was really, that was our first sort of what would then turn to become a forum, and then we had to cancel really last minute as the lockdown started to take place, and being in that position of this level of responsibility to bring people together, building up an organization was a big challenge. But I think as a community, we persevered, and I think it's not just due to me, but I think it's each and every one of us believed in what we do, believed in this mission, believed in our coalition, and we got there together. And now we are here today, so that's really wonderful.
Yes, reflecting on the partnerships and potential new members we're working to bring into the fold, how do these relationships align with your hopes for the World Bladder Cancer Patient Coalition?
So my hope is really, as I've already reflected a little bit, is for a future that is inclusive, that we really think about meaningfully and take actionable steps towards being inclusive of different countries, of different cultures and different environments that organizations operate, the individuals as well that run these organizations too, and that we're really focused on collaboration. That's what got us here after all these 5 years. I think this would not have been possible without collaboration that is much broader, that goes, beyond a couple of people. And now with the growing number of partners as well that we have, these evolving relationships with different stakeholders, we have established partnerships with different medical societies, international and regional societies, industry partners. And so we want to continue this. And as I mentioned, building capacities of different member organizations as well to feed in and bring that bladder cancer patient perspective into a lot of these activities through these relationships. And the growth from 3 members to 15, I think it's quite significant in 5 years. And I think now we're starting to see new groups form in Spain, in Belgium. We bring this forum to Latin America as well, and we hope we get closer to many representatives in this room, but also online or through building further relationships to also help bladder cancer patient support group establishment or growth or within the region as well. So I think that's really, really important. And lastly, I would say finding the right fit as well of how we approach challenges in low and middle income countries, because that's where, bladder cancer may be a smaller challenge amongst all the other things that are, pressing challenges within those countries. And so there are different approaches how we can do that, but I think we need to be mindful how we do that. And that's a very big priority for me for the next few years. And so going into the last sort of questions, Lydia, looking ahead, where do you see the greatest opportunities for growth and impact for World Bladder Cancer Patient Coalition in the next 5 or even 10 years, what initiatives or collaborations would you be, are you most excited about? And I know that your time is ending with us, but I think it's something a vision that you can leave with us to think about as well.
Yes, so I'm most excited actually about all the expertise that is in this room and is online, and the fact that we're going to spend today and tomorrow brainstorming and talking together and developing that vision. And then we've got a board meeting the next day where we'll continue that as well. So I'm just really excited to see more networking, more collaborations between all of the bladder cancer patient representatives. And a final question for you as we step into the next chapter of the World Bladder Cancer Patient Coalition journey. What guiding principles and personal values do you feel should remain at the heart of the World Bladder Cancer Patient Coalition growth and decision making?
I think our core values should remain the same. I think we are very committed to the vision of where we want to go. With being the representative for Global Voice, having patient or bladder cancer patient group in every country, and how we get there in the right way. But I think those should remain the same, because that's what's very much what drives us from the day one. Now, how also in the mission elements, I think they are very, very strong in raising awareness, building community, and engaging in advocacy. Those are the 3 core pillars of our mission that continue to deliver, I think, every year. And there are many initiatives that can come under that. So I think we strive for the same, and we continue to do that. But how we do that, I think that can evolve. And we need to adapt to the changing landscapes, how patient advocacy is evolving, what are the challenges and also opportunities for us to contribute to input to drive change in research and improving care, in advocacy and so on. So I think that's, as we grow the community, we work on that. And lastly, as I said, as we grow, we have diverse communities that we represent, diverse communities that join our coalition. And so we have a responsibility there to respond to their needs. And that's just something that I think we should continue focusing on and put more effort towards finding those common threads that I've mentioned earlier, find common threads that make sense to all of us, that we can really rally behind together with each other, and making sure that, we work towards the mission and the future where no bladder cancer patient or carer is left behind, no matter where they live in the world.
Thank you.